veuillez rappeler ultérieurement. The telephone number you dialed is not available.
Good morning, good afternoon, colleagues, friends, and partners. So wherever you may be joining us this afternoon for me. My name is Martin Mwangi. I am from the Healthy Mothers, Healthy Babies Consortium. I am based in the Netherlands, but as you know, the Micronutrient Forum is based in the US. Really a pleasure to host you today. And welcome to our interactive webinar, which HMHB has been discussing for a long time now with the Results for Development colleagues. And it's also based on a lot of requests from the members, the consortium members, because everybody would want to know, how do we go about costing for MMS at national level? So we have titled our webinar today as Accelerating MMS in Countries, Costing Strategies and Country Examples using the R4D Results for Development tool. And today we are going to delve into a crucial piece of this MMS implementation puzzle. The question is, how can we accurately cost, plan, and also enable country programs to reach every pregnant woman in that country using MMS? Most national government stakeholders want to be sure that it's not only the cost of the pill, but also what it means to deliver it at scale. And robust costing tools are available. However, we all need to know how to use them. So through the R4D costing tool, our stakeholders, especially national level actors, will be able to translate their policy goals into realistic, actionable, and budgeted plans. And hopefully this will turn the momentum in terms of delivering measurable impact in terms of health for mothers and babies. First, some housekeeping rules as you join today. Feel free to introduce yourself with your name and organization and country in the chat. And you can write your name and affiliation in the Zoom window and then turn off your video off. All participants will be muted during the presentation, but you'll be able to unmute yourself during the Q&A. We like to call this coffee and chai chat. The idea is that you meet informally in a cafe somewhere and you have some discussion questions and you even pull out your laptop and entertain each other with this costing tool. So if you like to ask a question, raise up your hand using the raise up hand feature. And when you're called upon, you can unmute yourself, you can put on your video, and you can ask your question. However, you could also put your question in the chat box, then you will be called upon. If you experience any technical difficulties, just message tech support directly and they'll be able to reach out to you. There is a tech support available as one of the contacts, so you just select tech support and you reach out to them. Just to inform all of us that we do record this webinar because other people view them during when it's convenient for their time zone. So I hope that's okay with you. And then today we are having simultaneous translation in multiple languages, I believe over 60 languages. And we are leveraging artificial intelligence for this using Wordly, which is a feature that is activated in your Zoom app. So if you look at your Zoom panel at the bottom and then you click apps, then you select Wordly translation and captions, you can select your preferred language in the drop-down menu. That is, of course, assuming that English is not your preferred language, in which case you can just continue to listen everything in English. To activate the captions, you need to do exactly as I said, select language in the drop-down menu and then read captions below. And then for audio, if you want to hear spoken audio in your language, you click on the Wordly link in the chat to open the new browser window. And then you click Wordly drop down on the top right corner in the Zoom, and then click Wordly and the new browser window will open. You select your preferred language, click the audio icon, live translation. There may be a slight delay during the first use, and then to avoid overlap with the English, you might want to mute Zoom app audio, and then you can listen to it in your preferred language. Towards the end, when you need to exit Wordly, you just close the browser tab and end Wordly audio translation, and that will get you back to the usual Zoom window. that will also stop the captions, the captions that you had enabled in the beginning. All this information is going to be put in the chat for you to quickly reference as you are, managing your Zoom window. So, and now I am happy to introduce our panel of experts. We have a strong panel of experts today. We have Amy Roberts joining us from Results for Development. We have Samari Godwin, who is the Nutrition Commodities and Logistics Officer, Department of Nutrition from the Federal Ministry of Health and Social Welfare, Nigeria. And we have Amna Hassana Abdulsalam, who is a Program Officer, Market Shaping Practice, Results for Development, Nigeria, although Amna is joining us from Rwanda, where she's at this very moment participating in the costing exercise for MMS in Rwanda. So both of these three people are going to guide us through their experience working with the costing tool, both from the global perspective, there perhaps Amy, and then with the country experiences, we'll hear from Samari and from Amna. So remember, this webinar is meant to be interactive, so we encourage you to submit your questions in the chat, raise your hand during Q&A, and make this a rich and insightful exchange. And with that, I would like to hand over to our speakers, and then I will come back to you during the Q&A section. Over to the speakers.
Great. Thank you so much, Martin. And just confirming that you can hear me.
Yes. Yes,
Excellent.
we can hear you.
Okay, great. Hello, everyone. Good morning, good afternoon, and good evening. We are absolutely thrilled to be having this discussion today. My name is Amy Roberts, and I'm from Results for Development. I'm happy to introduce kind of our work in the MMS space. If you can go to the next slide, please. So to share just a little bit more, I'm going to give a quick overview of R4D's work in the MMS space and just a quick overview of the MMS roadmap costing tool, just to make sure that everyone has kind of some of the same context coming into this conversation. And then we'll talk briefly about our experience in Nigeria, and then really look forward to an interactive discussion. So currently, R4D has been working in the MMS space since late 2022. Our work scopes, our scope, excuse me, includes supporting the governments of Ethiopia and Nigeria on MMS introduction and scale up. In Ethiopia, R4D, alongside UNICEF and the Ministry of Health, has been leading the roadmap development process. And that has included, obviously, the development of the roadmap, as well as recently the costing of it. In Nigeria, we're collaborating with several partners, including UNICEF, and focusing on costing the roadmap at the federal level and in 2 focal states. And then globally, we have created the MMS roadmap costing tool, and we've been speaking and working with a number of partners and governments beyond just the scope in Nigeria and Ethiopia. And so we're really excited to share some of that experience today. Thus far, we've engaged with governments in West Africa, East Africa, Southeast Asia. So happy to speak to specific experiences we've had, costing roadmaps, as well as some of the different questions that we've gotten throughout this process. I'll say that we're really excited to be a thought partner in this particular part of the MMS work. So if R4D can support you at all, if you have questions, please feel free to reach out to us. Obviously, we'll try to respond in the chat today. And we're also happy to talk if there's support we can provide a specific MMS roadmap costing process. So look forward to diving into things. Next slide, please. And you can go to the next slide as well. So I'm going to give a quick overview of the costing tool, depending on your familiarity with it to date. So this tool is an Excel-based tool. It's available on the R4D website. There is also a knowledge bite from the HMHB Africa meeting if you would like to take some time to get more familiar with it. But it allows you to cost an MMS roadmap, and it allows you to look at introduction and scale-up costs by year, cost category, type of cost, and will ultimately give you an estimate of the cost per pregnant woman reached based on, actual costed activities from your specific country's roadmap. Next slide, please. Just to contextualize where this tool fits. So this tool is best suited for countries that have generally already decided that they want to introduce and scale up MMS. You'll note that Nutrition International has an excellent cost-benefit tool that supports decision-making. And so that, that we assume if you're kind of going into MMS roadmap costing, you've already made that decision to scale up. There's a number of components that are excluded from implementation plan costing, and we list those out here on this slide, but there's a lot of just routine costs associated with the health system and the health supply chain that we're assuming are not going to be part of MMS roadmap costing. So I think it's just important to keep all of that in mind as we're entering today's discussion. Next slide, please. We use a simple activity-based costing method and look at costs over a 5-year timeline across some standardized cost categories. The tool itself is designed to be somewhat flexible. So, it provides a lot of prompts for how you would cost specific activities. And while we do provide standardized cost categories, there's some flexibility to rename the specific categories and make sure that the structure of the tool follows a roadmap. We've noticed that in several countries we've worked with so far, the desire even to standardize categories to mirror what's in the roadmap has come up and is something we can accommodate in the tool. But to reiterate, we've tried to take a really simple approach to how you would cost what's in a roadmap. Next slide, please. It's important to keep in mind that, while we have an activity-based costing approach, there's also some really critical inputs that go into the tool in terms of being able to understand your target population, target coverage, and estimate the number of pregnant women you're going to reach with MMS. Most countries are going to articulate this in the roadmap, but I think one of the themes that you'll see come up is it's really important to understand kind of going into the roadmap costing process. What are those outputs that we need from the roadmap in order to have an effective and efficient costing? This is a good example of them. The tool has some population data input in it based on some global sources, but that's something that can be customized for the country. And then, of course, the target coverage is something that we would expect to be sourced from a country's roadmap. Next slide, please. As I mentioned, the tool, and we'll have a little screenshot of it shortly, can give you the cost to introduce and scale up MMS in a number of different slices. So we are able to see the total cost of the plan, the total cost of the plan by year, by specific type of cost, by cost category, by introduction costs versus ongoing costs, and ultimately as a cost per pregnant woman reached. So we value kind of having the flexibility to look at and visualize the data in a number of ways so we can understand what the cost of scaling up MMS is. Next slide, please. Oh, can you go? Yeah, perfect. So as I was just saying, this is an example output of the kind of summary data you will have in the tool after you go through the process of costing the MMS roadmap. It allows you to see overall cost by category, which you see with the color coding on the left-hand side, as well as on the right-hand side, a table summarizing the actual numbers. Again, we've tried to just anticipate different ways that stakeholders or government might want to see the numbers summarized and visualized. Next slide, please. And actually, you can go to the slide after that. Okay, perfect. So there's a couple of things we really strongly want to advise and recommend countries that are about to go through this process. The first is we want to make sure we have a really clear MMS implementation plan before using the costing tool. That's a best practice here. The more specific we're able to translate our roadmap into an actual implementation plan, the easier and more efficient it is to set up costing. And so that includes being really specific around what kinds of activities that we're planning, when they're going to happen, and then we can, in the costing process, we can translate that into an activity-based costing to make sure that that we're able to capture all of the costs. It's good to keep in mind that sometimes the process of costing the roadmap will have you revisiting some of the assumptions in the roadmap and in your implementation plan. This is typical, and we actually think it's productive to to use the costing process and kind of be iterative with what's in the plan. But the most effective processes we've seen so far are taking kind of a really detailed plan and then putting it into the costing tool. Next slide, please. Just a quick note on how to access the tool. It's available on the R4D website. I believe it's available on the HMHB website, or if not, it will be soon. We also have an add-on tool for combining subnational geography costs on the R4D website. Depending on the specific way that it, like a regional provincial administration works in a country, sometimes that's necessary. We're also available if people have questions, happy to have a conversation or answer questions that are coming up with the tool. And we have our contact info here. It's also available on the R4D website. Next slide, please. Thank you so much for listening to my intro on the tool. I'm happy to turn it over to my colleague Amna to share a little bit about the process in Nigeria thus far.
All right. Good afternoon, everyone. Thank you for being here with us today. My name is Amna Abdulsalam. I'm a program officer with the Results for Development team in Nigeria, and I've been working on the MMS project there. Next slide, please. So the journey so far for MMS costing in Nigeria, like Amy mentioned, the global costing tool was developed last year in about April. And then in June last year, it was pressure tested with a few global stakeholders in Ethiopia, including stakeholders from Nigeria and from the Federal Ministry of Health in Nigeria. That tool was then finalized in July, and that is the version of the tool that we have on the R4D website. But like Amy mentioned, the tool is very flexible and amenable to country needs. So in February of this year, after the first iteration of our MMS introduction and scale-up roadmap was developed, we held an adaptation and sensitization and training for Nigeria stakeholders. This brought together stakeholders from the Federal Ministry of Health, as well as from our National Primary Healthcare Development Agency. And I'll go over some of the edits that they wanted to see in the tools and how we've made it more specific for Nigeria's use and needs. So that was done, and we finalized that in March of 2025. Then, like Amy mentioned, this tool works best with very specific activities. And those activities have to then be in the form of an implementation plan. So in May of this year, we finalized the development of the roadmap and developed implementation plans for the federal level transition to MMS. And then we are now in the process of costing the implementation plans using the Nigeria version of the tool. Next slide, please. So following the costing training in Nigeria, the tool was adapted for Nigeria's context. Some of the edits that were requested by local stakeholders was the ability to input data in local currency, use Nigerian data sources for the projection of the population and number of pregnant women. Like Amy referred to, the tool uses base inputs, such as the target population that you're trying to reach, because what we're seeing in some countries is they're not trying to achieve 100% coverage immediately. And then there are some countries that might want segregation between their public and private sector. Then we also incorporated additional columns for frequently referenced activities. In the initial version of the tool, there were some cost categories that were lump sums, but we preferred to have everything broken down because that is how the budgets in Nigeria are typically done. And then we added in standardized cost units that the Federal Ministry of Health uses for per diem, for local transportation costs, for venue, for printing, and so on and so forth. And that is what the unit costs will be throughout the tool. This is in order for everything to be standard and for it to be easily referenced in future. So the costing tool remains flexible and adaptable for further changes relevant to the Nigerian context, as the Federal Ministry of Health and Social Welfare requires. My colleague is also on the call today, Mr. Samari Godwin. He works in the nutrition department of the Federal Ministry of Health. So after I'm done, I'm gonna pause and he can come in and talk about his experience at the federal level training in February of this year. Next slide, please. So Nigeria's roadmap did not fit in seamlessly into the standardized cost categories. We have two phases in our roadmap: a rollout phase for 2 years, and then a scale-up phase for 3 years. And there are 23 primary activities. This was no issue. You can put in a great degree of sub-activities under one cost category. So we were able to fit in all of the 23 activities into the specific cost categories without having to make amendments to the cost categories. But like Amy mentioned, this is very flexible still. And if we had needed to collapse or the cost categories, that would have been easily doable with the tool. Next slide, please. So I just wanted to overview how an implementation plan looks that can fit into the tool. So what we have here is our main activity, which is monitoring of key indicators across the country, including MMS coverage among pregnant women, accessibility, and number of states. Now, this activity is too broad to fit into the tool, and so we need specific activities. And we broke this down at an implementation planning workshop with the Federal Ministry of Health and the National Primary Healthcare Development Agency stakeholders. And so you want activities that can be easily tracked to an output, such as adding an MMS indicator on the Ministry of Health Integrated Supportive Supervisory Visit checklist. This requires one internal meeting at the Ministry of Health and a one-day MMS task force meeting of 40 participants. And on the tool, this can easily be costed using the unit cost, knowing that you might need to provide local transportation, venue, and lunch and tea break for a one-day MMS task force meeting to ensure that MMS indicators are integrated into the ISS visit checklist. The same with the subsequent activities. We really wanted to make sure that everything had a very clear input and it could be mapped to a clear output. So conducting MMS monitoring of indicators included a national supervisor traveling to each state for 1 week biannually. And so therefore we have, a DSA for 1 week, we have travel costs for 1 week, we have 36 states in Nigeria. And so when this is costed, it will be 36 times 2 because it's happening biannually. And it maps directly onto that indicators are being reported during our MNCH weeks across at least 50% of states in the first year And as we move through the subsequent years, we're aiming to reach that to 100%. So I'm going to stop there, and I'm going to allow Mr. Samari to come in, and if he can just talk to us about some of the experience of working with the tool, developing the implementation plan, and how amenable it was to make it specific to Nigeria's context. Oh, I think he might have dropped Martin. I think he was
Oh.
having connection issues.
No problem. Do you want to make his remarks as well? Or just check whether Mr. Samar is on the chat or in the...
He was here. I think he might have dropped off. So I think we can move on. And when he comes back in, he can answer any questions that
Okay.
anybody in the chat might have.
Perfect, perfect. Now, thanks a lot to both of you and also to Mr. Samar. I'm sure he will be more than happy to speak when he comes online. This is really insightful in the sense that we not only have a representative of the people who work behind the scenes to get the tool ready, but also a user who can comment on how it has been applied. Now, we have been, in the meantime, receiving some questions through the chat, and I will just pose the first one. You can choose amongst yourself who wants to answer it. Perhaps it's more for Amy. Somebody asked, does the tool compare costing with IFA? And does the tool cost adding MMS or implementing a new program? Perhaps we can start with that clarification.
Yeah, absolutely. So the tool, as I mentioned, the tool does not sort of do the cost benefit decision between MMS and IFA. Right now, I think the tool is flexible, such that if a country wanted to include IFA costs as a part of the costing of the roadmap, that there's a possibility of doing that. Typically, we assume that, I think at least in some of the contexts we've worked in so far, that hasn't been a request. I think because it's assumed that there will still, like IFA is currently being procured and it will still be procured. But I think if having an integrated plan and being able to cost all of that together is desired, that's absolutely possible with the tool.
Awesome, that's good to hear. And for Amna, perhaps I guess somebody heard that I said you are currently costing for Rwanda. There's a question about the most common challenges that countries face when they are costing for MMS. In your opinion, what are the most common challenges?
I would say it is trying to avoid creating a parallel system. So MMS is just one commodity, and it cannot bear the weight of the full nutrition budget of most countries or most donors. And so some of the challenges we face in developing implementation plans is really getting government stakeholders and partners to see that you really want to try and integrate MMS into the system as well as you can, where there are already established technical working groups, where there are already established systems, you want MMS integrated into that system to save on costs, so that your overall roadmap doesn't end up superseding your overall nutrition budget, because MMS is one commodity. So I'd say that's the greatest challenge that we're seeing right now, making sure that we're not duplicating things that already exist or establishing new things that don't need to be established.
That's really well said. I can't add to that. Let me go back to Amy. You know, when people are doing costing, it sounds a little bit like modeling. So the question is, what are some of the most common misconceptions or bottlenecks that country teams face when they are trying to develop their own costing plans? I think you alluded to some of them, you know, like not starting with with a plan, like what they want to have in the plan. But if we see from what Amna presented from Nigeria, there were also some elements that were added to the Nigerian one to make it fit. But I wonder what would be your reflection on this question?
Yeah, there's a couple of different things that come to mind. I do think, so first of all, I do think we want to like demystify the fear that people feel when they hear the word costing. And I agree, it does feel like modeling. But I think the same way that across a number of different types of health programs, we've all become comfortable with the idea of forecasting and knowing that it's not this mysterious thing that, well, hopefully it's not a mysterious thing happening behind closed doors, but we are familiar with the idea that we have varying levels of precise data, or data that we have maybe varying levels of confidence in, but we have to make a number of assumptions and kind of take it through a process to generate an estimate. I think we try to take a really similar simple view. So obviously you have to kind of think about what are the core pillars. We know that product cost is probably going to be the large majority of the cost of this entire introduction and scale up process. So, that is probably something we want to get right in terms of making sure that we are bringing our best population data to the table, that when we set our coverage targets, we're I guess making those SMART goals where the targets are aggressive yet achievable. So if we're actually, setting aside those funds to procure that much MMS, we're confident it will actually reach people. And then, for the other areas, we're employing a really simple activity-based costing approach. So even if we think about some of the categories like advocacy or policy and regulatory, if we're looking at the costs required to, say, assemble a meeting and bring stakeholders together to make a decision, a lot of those costs are known in terms of what it costs to convene people. I was in a country recently where there was interest in doing like radio and television spots, for example. And the Ministry of Health actually had recent quotations and estimates that were based in, what was paid for some of the SBCC activities. So I think, I peeling back the layers a bit, it's simpler than it seems, especially if you think about, if we get the commodity and supply costs right in terms of our assumptions, that's about 70%, or something in a range of 60 to 80%, depending on what's in the roadmap. I think I've also heard a number of concerns around how do you validate what's in there. And I think I would also draw I would draw analogies to how do we validate what's in a commodity forecast, for example, where we know that there's going to be limitations to some data, and we're kind of pulling together our best estimates as well as like what we know things actually cost. And then where we're more uncertain, maybe we note that as something that requires some follow-up or some additional research if we really want to be certain, or if we're if there's a high degree of uncertainty. So I think those are all things I would highlight. And then lastly, I think this is probably unsatisfying, but the costing process is like the ease and simplicity of it is directly proportional to how well you've planned. No one wants to hear that, because sometimes creating a detailed Gantt chart is not fun, or it's a really dry activity to kind of go through and be like, all right, what year is this happening in? What does this mean? How many meetings is this? But the more systematic countries are about taking the roadmap and translating it to a plan, the easier it is to cost the roadmap. Those are my initial responses.
There's been a bit to unpack there, and I'm sure Amna will also reflect. Before Amna, there's some questions for you as well, but I am informed that Samari has joined, and I wanted to give him, I don't know how long his connection will hold. I wanted to give him an opportunity to make his comments, and then we can take the questions for Amna. And also to remind the audience that if you have a question for any of our speakers, feel free to unmute yourself, put on your video and ask directly. It's an interactive chat, so also take advantage of that. Samari, can you hear me? And if yes, are you able to join the speakers and make your statements? Perhaps you may need to unmute yourself if you're hearing me. I hope tech can help us with the unmuting. If as that is being worked out, the questions that we have received for you, Amna, if just to add to what Amy was saying, first, it's about Nigeria specific. There was a question about ISS. I'm trying to pull it back. Yeah, if you can share the actual MMS indicator for the ISS checklist, as well as how you define MMS coverage in the tool for Nigeria. And then another one for you is shadow costing. Can you offer some practical guidance about shadow costing of non-monetary asset use? If this was actually asked by Keith West, I know he's in the audience and he's not one of those who are shy to speak. So, Keith, if you want to unmute yourself and clarify your question, that's also fine by us.
Yeah, thank you. Thank you, Martin. And it's a great talk. We really appreciate this session. No, my question relates to, the use of assets that have value that you need to apply a cost to because of use over time that some folks may appreciate hearing about. That it's not just the flow of cash and money, but utilization of assets that amortize over time that you may have to put a cost to in planning these kinds of exercises.
I'm curious, do you have an example of that? I want to make sure I'm
Vehicle usage, over time, photocopy machine use, laboratory equipment use over time that requires maintenance or replacement, those kinds of
storage space.
Yeah, that we don't often apply a cost to, but that actually has cost elements to it.
Absolutely. My background is in supply chain, so that question resonates quite a bit. I think right now, the way we're positioning the tool and thinking about MMS in general, we're looking at a lot of the sort of roadmap, introduction and scale up as catalytic costs, with the idea that some of those ongoing costs will be accounted for, absorbed by the health system. I think we could debate whether or not that's reasonable or accurate. I think if there are sort of ongoing broader health system costs around supply chain, for example, those could be budgeted for discreetly. But I think given the desire that we're hearing, that we've heard, and that we think is really reasonable to have this be incorporated into the broader ANC system, we would expect that's not necessarily something we're thinking about with specifically MMS introduction and scale up. So I think that's how we're approaching it right now. But I think if there are discrete costs or like buffer costs, there are ways to build in some of those things in the tool, but beyond that, we are expecting that the broader health system has something to kind of contribute financially to ANC. Yeah.
Thank you.
You're sort of talking about margin or what is the cost of adding? So we say the system's in place. What is the marginal cost of adding MMS? And the approach that you're talking about makes a lot of sense for that. until you have to worry about something like separate shipping costs or, right, something like that. So you could say, oh, well, this is already in place. We have the women coming, we give them, I don't know, iron folate, or we do something. And now we're just saying we want to add that.
Mm.
So we've got some shelf space, we can put the boxes on, it's not going to cost anything. But I would say if you don't think about that, you might, I'm thinking of my own experience, run up against, well, we shoved the boxes under the desks in the clinic, but all of a sudden, too many boxes. You know?
Absolutely. Yeah. Yeah.
So I can
I-
also
Yeah, go
come
ahead, Amna.
in both Nigeria and Rwanda, what we're seeing is they are trying to factor in some of those incremental costs or upgrade costs that are needed. But because this roadmap has a shelf life, it's 5 years only, you want to find a way to integrate it into the health system. So the typical budget route for upgrading warehouses, you want it in your annual budget and you don't want it budgeted separately as part of MMS, because if you remove it from your national budget in 5 years when this roadmap rounds off, then you are facing a gap in financing. But we are seeing that in cases where there needs to be a system strengthening catalyst, this tool, you can budget for those incremental costs to sort of catalyze funding, but keeping in mind that this funding does have to be transitioned to a more sustainable system instead of creating a duplicate parallel system. So for instance, purchasing new vehicles because maybe you don't have vehicles for last mile distribution for all your nutrition commodities. That's a good example of a cost that can be budgeted in this tool, and we're seeing some country governments use that. But if you already have existing systems, not throwing it away to have an MMS separate delivery system. So I hope that answers some of your questions of what we're seeing in practice of the tool that country governments are doing.
And just to chime in also, I mean, I think we share a lot of concerns that this community has about antenatal care in general needing to be strengthened and being underfunded. So I think some of the broader points around the system's ability to identify, serve, and provide good service, kind of almost go outside of MMS introduction and scale up, though we're hoping that this is an opportunity to continue that strengthening process.
I want to jump in here and request a couple of people to also ask their question, or I can ask on their behalf. Sarah Rowe.
Sorry, Martin, I never answered the ISS question, and I feel bad.
Go ahead.
I'm actually going to do that now.
Because we have quite a couple of questions that we want to direct to you. Go ahead.
So for the ISS question, that I don't have the exact indicators, but that was going to come from the Nigerian government, and unfortunately, Mr. Samari's connection isn't strong enough, so I don't have that. But in terms of what was the second part to the question?
I believe it was indicators for the ISS checklist, as well as how you define MS coverage in the tool for Nigeria.
So for Nigeria, we did a coverage that was incremental using we have MNCH guidelines and ANC guidelines for iron and folic acid coverage that we want to meet nationally. And I believe that is 70%. So our MMS scale up across the 5 years is incremental, and you can factor this into the tool at the very beginning of your base inputs, where we're going from 30% in year 1 to 70% across 5 years.
Okay.
Martin, can I just clarify that? Can you define that's how many women you want to reach, but when you're defining reach to a woman, what does that indicate? When we talk about MMS coverage to the pregnant woman, what can you define that, please?
So just to mention, that is Jenny. I believe Jenny.
Yeah, hi everyone.
Hi, Jenny.
When you speak, just remember to say your name and where you're joining us, so that at least people have the context. Go ahead.
For Nigeria's purposes, ANC coverage, sorry, MMS coverage is defined as a pregnant woman visiting a primary healthcare center and being able to receive MMS.
But we're costing how much MMS is going to go to each pregnant woman. So is this one tablet per day throughout pregnancy? Is it a bottle of 180? Can you
For
define that?
Nigeria, we're doing 180 over the course of pregnancy. So that's what's counted as a woman is covered, that she has received a 180 tablet bottle, which also the tool can factor in for the different types of tablets, bottles that you're procuring. But for Nigeria's purposes, we agreed on 180 tablet bottle as a dose coverage.
So one bottle per woman. Thank you.
Yeah. And I will say in the supply portion of the costing tool, you are prompted to sort of go through all of those assumptions. So you spell out, what does a full course look like? What is the bottle size of the product, or the number of pills, and then what is a full course for a pregnant woman? So a country would have to kind of spell out what those assumptions are as a part of the process.
Thank you. Thank you very much for that. I hope Jenny, but I'm sure Jenny also knows where to find all of you.
Yeah, it's just curious because each country seems to, when we use the word coverage, it just seems to be translated differently per country. And I think when we present this, it's good to define how each country is defining that, because I think it helps other countries and also the costing. But thanks very much for that clarification.
And that ties nicely with Sarah's question. I can ask it for her, but if she can get online and ask the question herself, would be even better. Sarah Road, are you there, or should I ask the question for you?
I'm here. Thanks, Martin. And thanks for the presentation.
Introduce yourself and ask the question.
Sure. So my name's Sarah Rowe. I work with Nutrition International. My question is quick. I don't want to take from the others in the chat, but I just wondered if there's a summary available of...
Sorry, can mute somebody's unmuted.
Okay. So just quickly, I was wondering, given a lot of countries have started using this, is there anywhere where some of the estimates have been published, or maybe published is a big word. I mean, is there anywhere where there's a sharing of some of the costs per pregnant women that are coming forward from the different countries, just to get a sense of kind of reference points and how much it's costing to reach a pregnant woman with MMS?
That's a great question. I think right now we're kind of threading that needle a little bit, because a lot of the costings we've done are sort of preliminary, or like the first full draft. And so, you know, governments aren't necessarily keen to make something that's not official yet public, and something that's still subject to revision. But I think the broader point around how do we capture what's coming out of these processes and share them transparently resonates quite a bit. And I think as we get maybe further along in the process, we're happy to share, especially when some of these roadmaps and summaries become public, we're happy to share what's being found and what those average costs are. I think right now in some of the places we're working, that those figures are preliminary and so a bit sensitive, but I think we're keen to share broadly like lessons learned and some of the general figures coming out of it as we move further along.
Thank you for that. So there are two questions that are, one was more I think would have applied more to Mr. Samari, so I hope Amna can take it. And the other one, maybe Amy can weigh in. So the first one is on the costing implications if MMS is procured from outside the country, and how the tool is able to capture that. Maybe perhaps Amy, you can take that. And then Amna, if it's okay with you, there was a question, what the technical assistance or capacity that is most crucial for country teams to maximize their use of the costing tool. What I guess it's what is a technical assistance or capacity strengthening that is most crucial for country teams to maximize their use of the costing tool. So I guess from a country perspective, what they would need to be able to take full advantage of this costing tool from where you sit. Perhaps we start with Amy, and then we come to Amna. And just to the audience, I may have a chance to take an extra 1 or 2 questions. So if you have a burning question, get ready to unmute yourself and ask it to our team of speakers. So who wants to go first?
I'm happy to take the sort of supply question. I mean, I think that I know, well, I know from experience that sort of anticipating and planning for the supply of MMS over the next 5 years feels like an uncertain exercise because there's a lot of work going into the supply side. And I think a lot still to come on what some of the procurement options are going to be for countries. The nice thing about the tool right now is that there are a lot of, in the supply tab itself, there are a lot of places to input different assumptions around where we expect to procure, what we think the price is, what we think that the landed cost multiplier of bringing the product into the country is, the wastage rate, additional buffer costs, the ability to enter different prices from different suppliers. And so, you know, obviously it's going to be difficult to predict which suppliers come online in the next 5 years and what the prices of those products are, but we hope that there's enough places when we're estimating supply to input different scenarios and buffer assumptions that you're able to adequately budget for how much it's going to cost based on what's available. And obviously those things can be revisited over time as the supply landscape changes. But I would point to sort of the 3 or 4 fields where we can add in buffer in the tool to make sure we're estimating enough. And Amna, I'm happy to turn it over to you for the other question.
Thank you so much, Amy. So in terms of technical capacity, what I saw in Nigeria and what I'm seeing in Rwanda is really those sub-activities. And I think Amy alluded to it as well. This tool is really easy to use once you have your activities laid out in very specific ways. And so countries really want to assemble a team that knows how to do implementation planning. If you look at a roadmap, you often see a high-level activity such as reduce stigma. But reducing stigma in and of itself is not an activity because that is not a costable activity. So you really want to break down everything into what, how, when. So what is the reducing stigma activity? Is it advocacy to traditional leaders on a quarterly basis with 10 traditional rulers, and you're going to pay them transportation allowance for convening them? That's a costable activity. So we really want teams that understand how an activity leads to an output, outcome, and eventual impact. And I think that was something that worked really well with Nigeria because we did our implementation plans alongside sort of a technical strengthening on implementation planning.
That's very robust. I will save my question for my later. Bea Rogers, your hand is up. Do you want to unmute yourself, introduce yourself, and ask your question?
Sure, thank you very much. This seems to be a challenge with any kind of costing where you're looking sort of toward the future and expanding. But in the one of the slides, you showed target coverage, and it was, I don't know, 40, 50, 60. So 5 years, we hope to reach 60. And we all know that reaching the last 20 is the cost per beneficiary is going to be higher. But I'm not going to say, I mean, I was about to say, but they're the neediest. I'm going to say they're just as needy. But I'm wondering how, if you're planning a program, do you just say, well, too bad, 40% or 50%, you know, whoever it is, they won't get it? Or do you somehow put in some cost projections for reaching those most difficult to reach last mile, you know, last percentage potential clients?
That's a fantastic question. And we need voices like that in the room as countries are doing the roadmap development process for exactly the point you raised. So, I mean, we would hope that a country is embedding some assumptions around that in their MMS roadmap and planning, noting that, you know, especially as we're looking at the current state of ANC, if we want dramatic increases in coverage, we have to look at what that is going to look like as you reach different parts of the population. So I'm hoping that in the room in those discussions, there are people who are asking those questions, and we're acknowledging that increasing coverage is going to be expensive. If we're talking about pure costing, that would mean we're planning more activities and more targeted activities for that population as we're scaling up MMS. And then we're looking at the cost of doing that and recognizing that it's more expensive. So I think there are ways to do that, but it does go back to how well the government plans and anticipates what reaching additional populations will cost.
Yep, it just acknowledging this.
Yeah, absolutely.
Excellent.
And also, I will say, I think that's just hopefully if we make the roadmap, we cost it. We don't just let those things sit on a shelf. We're monitoring how it's going, and we're looking at year after year, who did we think we were going to reach? Who did we actually reach? And how do we have to revise our plan to meet it? So, hopefully it's not a one and done exercise. We're actually monitoring and adjusting course as the years go on.
So we are almost coming to the end of our webinar. There is one question that we wanted to also put to Amna, and it's about stakeholders at national level, but we also know that development partners are at national level and also the global platform. So the question is, how can these stakeholders across sectors, whether it's from governments, donors, suppliers, implementers, how can they collaborate better to make the costing process more realistic and sustainable, considering that in the nutrition world, we've not had to do this for a long time. We've only had IFA since I started my career, and now we have a new intervention, and there'll be more, right? There'll be more interventions that come on board. The costing process is largely similar. How can we achieve better collaboration so that we can make our costing less painful, if you can forgive the language?
I wish Mr. Samari was here. So it's honestly, the tool has lets you see how much it's going to cost to do everything. And when you start off, it seems like a small number, and it quickly becomes a very big number. But we also have a funding summary tab where commitments from both national governments and subnational governments and implementing partners can be made. And it allows you to see the gap you're missing across all the subcategories. So if you're really seeing massive gaps in your demand generation, then you can reallocate your financing to make sure that you're covering what you might deem the most priority. But it really goes back to what I was saying about integrating into systems. In Nigeria, as we started our implementation plan, as the cost started to build up, it really made stakeholders sit back and think, this already exists. There's a technical working group. We don't need to set up another meeting that's going to cost us an additional funding. And so where we can, you integrate it into an already existing system. The way we warehouse and distribute commodities from the federal to the state levels, you don't need to set up a parallel supply chain. So things like that can be factored in. But yeah, unfortunately, it is going to be a large number for a lot of countries. Nigeria, as you know, is the most populous African nation. Our estimated pregnant woman population is 12 million for this year and rising. And so, yeah, you have to make those contingencies and stakeholders just have to remember MMS is not the only nutrition commodity that we have, we're funding. It will make a world of difference, but we have to find a way to make sure it doesn't also overshadow other necessary interventions, and where we can maximize funding, we should.
Excellent. Very well put. Amy, I'll give you 30 seconds to make your closing remarks, because I think I'm happy to accept Amna's statement as very nice closing remarks. And then I will come in and we can close. Over to you.
I think I'll just say thank you for the great engagement and questions. I think some of our questions and discussion have continued to reinforce the importance of the planning process and making sure we have a really good plan before we start asking how much it will cost. And I think I just want to offer R4D support as a thought partner to different partners, country governments who are going through this process. We're very happy to share lessons learned as we're engaging, with Ethiopia, Nigeria, Rwanda, countries in Southeast Asia and West Africa. Happy to share lessons learned, advice we have, answer questions that are coming up, and please, please think of us as a thought partner and someone who can support the MMS scale-up process.
Thank you. So thank you very much to our speakers, Amy Roberts from Results for Development with her colleague Amna, Abdulsalam. Samari could not join us, but I'm sure we can type his questions to him and we will get the answers. That also applies to all the other questions that were not answered in the session but were asked. We will send them to the speakers, get the answers, and share them with you via email, and also the recording of this webinar. So the webinar underscores a few key takeaways, but they're also not small. So first of all, one thing that I got is that costing is really not just a formality. It's really a powerful policy tool because it helps you pull the roadmap that you have developed at country level. You kind of have to discuss it. You have to give it resources. You involve the right stakeholders, and that makes sure that you pull. Everybody now knows what's their piece, and it's costed. And therefore, once you get the commitment on the table, then you can go on to implement. The R4D costing tool brings adaptability. It brings a standardization, and it's a data-informed framework that country teams can leverage. And you've heard from Amy and Amna. Support is available. Reach out to them, and they will be able to guide you and your country teams. Finally, collaborative country leadership is necessary. That's what we got from Amna in her closing statements. There is technical assistance available, but at least governments need to be on the forefront. They will be able to make better and more sustainable financing decisions once they are able to accurately, well, at least close to accurate, cost their MMS journey. So last, I want to wish everyone sincere thanks to joining this webinar, including our funders, the Gates Foundation, that has made this possible. And we want to invite you to the next series of webinars. And so keep up doing the good work. And I hope every woman in whatever corner of the world, every pregnant woman, I must say, can be reached with a bottle of MMS during her pregnancy. That will be a win for all of us. So thank you, everybody, and see you next time. Bye-bye.
Bye, everyone. Thank you so much.
Thank you very much. Bye.
Bye-bye.
Bye.
Thank you.
Cheerio.